Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to be with Stan Clymer, Navy veteran with Maxor Plus, here with us today to learn a little bit more about his background, history, and experience, and how he's serving the union labor market today. So, Stan, thank you so much for joining us.
Mr. Michael Fina, always a pleasure to see your smiling face, to be
Thanks.
in your company, and very sincere congratulations to you and Stephanie on the Union Labor Advisory Network.
Thank you very much, Stan. Appreciate
word on the street is must-see TV, man. It's
appreciate that.
Thanks. Okay, so I've been around for a while. I will sum it up in probably three numbers. I was the first one 76, second number is 48, last one's 51. 1976 was the first year I started in the healthcare industry. 48 years later, I'm still standing, gainfully employed, direct deposit every 2 weeks. Love it. And when I did try to retire, my darling wife of 15 years said, I really love you, honey, but get a new job or go play in traffic. So here I am.
Thanks, man.
Anyway, I spent long periods of time with Cigna, Express Scripts, Centene's, Specialty Pharmacy, Acaria Health. Then I did a stint in biotech, which I'll talk about later. And here I am at Maxor. And I love this. I mean, I really love the company. I love the camaraderie. I love the honesty, the culture, and we just have fun. And I'm really having a good time.
That's great, Stan. That's great.
So two things I'll talk about. I want to talk about Maxor, obviously, and then I really want to touch on the complexity of the pharmacy ecosystem in which we live. I think that's really important for everybody to just get a handle on. Right?
Yep. So, okay. You gave us a couple slides. We'll put them up right now, too, if you want to walk.
Please do.
Sure.
Okay, good. Okay, got it. Okay. It's interesting. Our history is Maxor was started by two gentlemen in Amarillo, Texas, 98 years ago, 1926. You can see up on the top there, it says around 100 years ago. And there's two gentlemen, Mr. Maxfield and Mr. Orr. Thus, the name of the pharmacy was Maxor. And that is our name today, 98 years later, 94 years later. So we have actually four different divisions, and I'm going to go from right to left on the slide here, Mike. First one is our Maxor Pharmacy Services, which is we're a leading provider in outsourced pharmacy management and operations for hospitals that want to have pharmacies but really don't want to be bothered with the management and the inventory. We have a very large footprint there. We have about do it for about 100 hospitals. Then we have our specialty pharmacy, our home delivery pharmacy, and then the company I represent, Maxor Plus. And again, it's we have four key centers, still headquartered in Amarillo, and we got centers in three great football towns: Dallas, Kansas City, and Pittsburgh. Right? What else can you ask for? Okay, what do we got here? Okay, here's our value prop. Or I should say our proposal, not our proposal. First is trust. The first thing we have to do is just as I say, for all the salespeople in my position, you have to earn trust with the consultants and the brokers. They're the conduit that feed all of the RFPs in the marketplace to the PBMs. So once you create that trust, the eye contact, and they trust you, because if they give us an RFP and we screw it up, that tarnishes their reputation as much as ours. So the key is having great relationships with your consultants and brokers to make certain that they know they can count on you. Okay. Can you put up the next slide if you don't mind?
Sure.
There we go. A real thing is we're really great on service, and I really mean that sincerely with all my heart. We have 99% implementation satisfaction, 96% member call center satisfaction was big, and 97% account management satisfaction. Those are big numbers in our industry. And the net promoter score It's an industry standard of rating your vendors. And from all the PBMs, we have it 73. And as you see down there at the bottom, the national average is 42. So we're very proud of that. We like to point that out. The other thing I want to talk about is improved outcomes and services. If you go to the next slide. I told you earlier I had a stint with a biotech company. It was called Cipher Medicine. They're headquartered right outside of Boston. And what they've created a molecular signature test where basically they just take your blood and spin it, and they will tell you not if you will, but if you will not respond to tumor necrosis factor inhibitors for rheumatoid arthritis, which is very, very costly. Think Humira, Enbrel, Sterella, Simponi, Cimzia, and Remicade. So, and when you have this test, only 1 in 3 people respond positively to these very expensive drugs. So this, and the test is only $2,400. So why would you put somebody in a $60,000 a year drug when you know it's only 1 in 3 people are going to respond? So we have contracted with them, and we have the ability to provide the test to the physicians, where they can tell if the patient's going to respond or not. Mm-hmm. So that obviously leads to great areas. So improved work function, lower mortality, decreased pain, quality of life, the whole shooting match. And it's a I don't know how you can lose. Okay, these drugs are like $60,000 a year. Let's just say they're $50,000 a year, right? So if you get 3 patients, you're paying $150,000. The tests are $2,500 a piece. So you can spend $7,500, and you just can't lose because only 1 in the 3 people are going to use that treatment. So that's sort of a no-brainer, but it's and the reason you hadn't heard about it for a while because they couldn't get CPT code from the American Medical Association, which means Medicare wouldn't pay for it and Medicaid wouldn't pay for it, which means the commercial plans won't pay for it. Now, if they have the number, you're going to see this very more prevalent in the marketplace. And so, I guess I said before, I think we're the only one that's contracted with Cipher for this product. So keep that in mind. Okay, so let's pivot over to the ecosystem, the complexity. There we go. First and foremost, I want to thank Adam and Paula Fine from the Drug Channels Institute. I reached out to them and they gave me permission to use this. And you see, it says U.S. Pharmacy Distribution Reimbursement System. Look at the top. There's the manufacturer. They spend $1 million on research and development. They finally get the product to market. There's the patient all the way down at the bottom waiting for the drug. And you can see all the stops in between. But the key to the slide is the product movement, the financial flow, and the contract relationship. So all those stops from the manufacturer to the patient, they all have dollar signs attached to those. So if you look, say there's the wholesaler, there's group purchasing organizations, there's pharmacy service administrative organizations, there's pharmacy benefit managers, there's health plans, there's TPAs, not to mention hundreds of subcontractors that work with all these people. So I'm just trying to lay out the facts here that it's a very, very complex system. And I just thought it would be nice to share with everyone.
Without a doubt, I'm sure. I mean, yeah, a lot of moving parts, a lot of people touching the drugs before it even gets into the patient's hand, right?
Exactly. Okay, Mike, let's refer to the pharmacy benefit managers. There are 66 pharmacy benefit management companies in this country. 6 of those companies cover 94% of all the drugs that are dispensed in the country. The other 60 are fighting for the 6%. Now, I'm not saying this is this is just a fact, but it's very, very, very disproportionate. So, which leads me to my close. Okay, Mike, in closing, on this slide, what I'd like to say is there's 3 things we bring to the table. Guaranteed. Competitive pricing client and member satisfaction, and honoring the contract the way it is written. You can see that all leads to our commitment to excellence. And the only thing I would ask is that we are invited to the table so that we can sit down and discuss our value proposition with the prospective clients. That's my story. I'm sticking to it. And I thank you very much.
Thanks, Stan. Thank you very much. And thank you for reviewing all these information. Let me get this off the screen right now. But when you talk about relationships in the labor space as well, you're supporting and representing a lot of members. So it's very important to make sure that you're providing the best service, quality price. And obviously, when you're dealing with members and their retirees, you want to make sure that they have a contact to work with and support. And I know you've been around for a long time, like you mentioned earlier today. So you've been doing something right. And again, I appreciate all your support and in servicing the union labor space. So thank you, Stan.
Thanks for having me. And I guess I'll see you at the next Association of Benefit Administrators meeting in the city, right?
ABA, Teamsters, and NLMC, IFEVP, whenever those acronyms are, we're at half those conferences already.
We'll be there.
But it's great to see you. Appreciate all your support, Stan, and look forward to seeing you soon. Appreciate your time.
Give my best to Stephanie and take care.
I definitely will. I'd like to thank all our sponsors for helping to build and promote the ULA Network. It is because of you that we're able to support, educate, and promote informative content relative to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.